Please start the session.
Hello. Hello, Principal sir. Am I audible?
Yes, yes, yes.
Hello and very good evening to you all. I am Shanga Shubro Ghosh, HOD of WE Department and Coordinator of this webinar. Engineering and Technology Malda. I welcome you all to this webinar. Here I want to take the opportunity to welcome our today's honorable speaker, Dr. Nevin Makram Labib, Professor of Computer Science and Information System Department, Sadat for Management Sciences. Professor of Computer Science and Information System Department, Sadat Academy for Management Sciences, Cairo, Egypt. Let me remind you that today's topic of webinar is data analytics to fight COVID-19. But before going to start this session, I would like to mention the guidelines to be followed by the participants. First of all, please kindly mute your microphone to ensure that there is no background noise during the webinar. Also, never click on the present now option during this session, as this present now option is only for the honorable speaker. In case you accidentally exit from the meeting, again click the meeting link and click the rejoin button to join the session. Please never mute our honorable speaker. And lastly, don't type anything unnecessarily on the chat box like good evening, participant's name, etc. This chat box you can use at the end of the session for queries only. And at the end of the session, we share the feedback link for so that you can fill the same for the successful generation of the e-certificate, which you will receive in your email ID provided within 14 working days. Now, I would like to request our respected principal sir to say a few words. After that, we will start today's session. Thank you. Over to you, sir.
Thank you, Professor Ghosh. Am I audible? Am I audible?
Yes, sir, you are.
Yes, your voice is audible.
You are audible, sir. You are audible.
You are audible.
Okay, so thank you, Professor Ghosh, for starting the session, and very good evening to all of you. Myself, Dr. Sudipto Das, Principal of IMPS College of Engineering and Technology, welcoming you all to the session 7 of the webinar series 2020, conducted by IMPS College of Engineering and Technology, Malda, West Bengal. Today's webinar is on a very important, desirable topic, data analytics to fight against COVID-19. And it is my great pleasure to introduce to you our honorable speaker, Professor Dr. Nevin Makram Labib from Egypt. She is presently working as professor in Computer Science and Information System Department, Sadat Academy for Management in Egypt. And I would like to share few details with the participants regarding our honorable achievements of honorable speaker, her research domain and specialty, and and her curriculum. So I will start with this. Apart from her own university, she is presently engaged with so many other universities in designing different kinds of course curriculums. Presently, she is guiding several numbers of graduate students in addition to supervising MSc and PhD theses. She obtained her master and PhD degrees in artificial intelligence from Alexandria University, Egypt. Presently, she is the member of editorial review board of Egyptian Computer Science Journal, and in addition to this, she is associate editor for International Journal of End User Computing and Development by IGI Global USA. And she is engaged with the review process of different indexed peer-reviewed journals, and he has numerous number of publications on the following domains: artificial intelligence, data science, and knowledge management. And one of the biggest achievements, she obtained the Achievement Award from the International Academy of Sciences in 2005. Her current research group, UNEV, focuses on healthcare informatics. She is subject matter expert for healthcare informatics in the
Hello, Principal Sir, please unmute your mic. Hello, sir. Hello, Principal Sir, please unmute your mic.
yes.
And you are requested not to mute the organizers like our principal sir, myself, and our honorable speaker. Please do cooperate. Thank you.
Professor Ghosh.
Yes, sir, you may continue, sir.
Hello, Professor Ghosh.
Yes, sir, you may continue, sir.
Yes. When I was muted, actually.
Just few seconds.
Okay. So apart from this, presently, as I mentioned, her research area includes a variety of topics: artificial intelligence, data science, then data analytics, knowledge management. And apart from this, she deserved different or achieved different kinds of achievements. In Egypt, regularly he hosts different TV programs in the subject related to digital transformation, administrative reform, and information technology. And really, we are honored, and on behalf of IMPS College of Engineering and Technology, I would like to thank Dr. Labib that she accepted our invitation for today's session. Hopefully, the session will be very informative, as the topic is very important too, as far as the requirement of present pandemic situation. So I will again request to each and every participant that you have managed your time, you have given your time. So hopefully you will listen to the session very carefully. Unnecessary, please do not show your screen. The screen should only share the honorable. She will present his slides or PPT. And please do turn off the mic of the speaker. There are so many participants who are active enough and eagerly wait for the today's session. I would like to mention one more thing. That for today's session, we have received the highest number of registration. It is more than 1,200. But unfortunately, we can allow only 250 participants as far as the criteria set by Google Meet. So hopefully, it will be a nice session. So on behalf of IMPS College of Engineering Technology, I would like to welcome Dr. Labib. Professor, Madam Labib, you can please continue the session. Thank you.
Thank you so much. So good afternoon for those who are in Egypt, and good evening for those who are in India. Am I audible? Can you all hear me?
Yes,
You
yes,
are
you're
audible.
audible.
Yes,
Clearly.
madam.
Yes.
Yes, ma'am.
Okay. Thank you so much. First of all, let me welcome all of you. And let me welcome my dearest colleague, Dr. Hiba Wishi. Thank you so much for being there. That was very nice of you. I would really start by thanking the college for the kind invitation. It's always a pleasure to be with such eminent people talking about important topics. I would like to thank all of you for attending. That means a lot to me, and I hope that the session will be interesting for you. By the end of the session, I will be more than happy if the college can share my information with you. You'll be able to contact me either on Facebook, I have a page on Facebook, or on Twitter, or on LinkedIn, or even by email. So I will leave all of my coordinates with the college, and you will be able to contact me after the session. Okay, I would also like all of you to mute your microphones so that I can present and that you can hear me clearly. So I think that there is someone presenting. Okay, thank you so much. Okay. Now, can you see my presentation? Okay, I will assume that it's visible to all of you. Okay, so I always start by this slide because it means a lot to me. I'm sending you greetings from Cairo, Egypt, my beloved country. So in this slide, you can see most of the lovely places in Egypt. Now, our talk today, or tonight, for those who are in India, will be about how to make use of data analytics in order to fight COVID-19, which is a pandemic, as we all know. As per the nice introduction, I am Nireen Makram Nabib, Professor of Computer Science and Information Systems. I'm actually chairing the Department of Computer and Information Systems in Sadat Academy for Management Science. And I'm an SME, subject matter expert of healthcare informatics with the American University in Egypt.
Madam, could you please open the slides? We can see the slides, ma'am.
Can you see the slides?
No, ma'am. The presentation is on, but the slide is not actually visible.
Okay, that was my question. Okay, I will put it again. Now, is it okay? Can you see it now?
No, ma'am.
No?
Ma'am, can you stop sharing and then again try the same?
Do it again, yes.
7 years old.
Can you see it
Yes, ma'am. Yes,
now?
ma'am. We can see right now.
Okay, great. Okay, thank you so much. Okay, so that was the first slide I was talking about Egypt. And I was just introducing the topic. It's how to make use of data analytics in the battle against COVID-19. Regarding the session objectives, I thought about 4 main objectives. First of all, we need to explain the concept of data analytics. What's the difference between data analytics and the usual analysis or the traditional analysis techniques? And we need also to identify the different roles of data analytics in order to fight COVID-19. Then discuss the various challenges related to implementing data analytics for this purpose. And finally, we will try to explore some solutions to the currently faced challenges. As we all know about COVID-19 outbreak, this virus started in China, but unfortunately it has spread to many, if not all, countries over the world. The WHO has declared that it's an emergency and it's pandemic on January 30, 2020. Since then, health organizations and governments are tracking the spread of this novel coronavirus since it has many bad consequences over the lives of people, the economic status of all countries, and so on. But on the other side, people found out that that was one of those instances where the lives of people depend on technology. So let's first try to identify or to explain or to define the data analytics. What's data analytics? We said that we need to differentiate between data analytics and data analysis. For analysis, we used in old times, when I was a student, undergrad student, that our professor used to explain to us that we have some data, we collect this data, and then we analyze it, either in a logical or a mathematical way, and then we get some information that we provide to the decision maker in order to take suitable decision. That's in the very old times. But what about analytics? For analytics, we are talking about deep analysis. So we'll go for raw data, and these raw data need to be collected from various sources. It will be in different formats. We will work on it using different techniques as we will proceed now. And we will get some conclusions. These conclusions will help to direct the decision-making process. So it takes kind of an upper hand. It's not only providing a report or just some information to decision makers, but it goes further, providing them with some patterns, more help and more support to decision making. In order to do so, we need to make use of some techniques and some processes and algorithms. We will explain all of these terms now when we go through the process of data analytics. As we all know that there are different techniques. These techniques may be borrowed from the artificial intelligence discipline or from the statistics or sometimes from mathematical models. It depends on the problem at hand. These techniques help us to reveal, to uncover trends and metrics that would have been otherwise lost. Why do we say so? Because we need to come with lines of treatment. We need to come with metrics, with ways to measure the outcome of any problem. These are the different stages related to analytics process. First of all, the trigger is data requirements. We need first of all to know what is required. Like for example, if we are talking about diagnosis or differential diagnosis, which is trying to diagnose and to see if the current symptoms pertain to or to any other disease. Okay, what can we do? So we think in a different way. We think using the mindset of the user. So for example, if that's the medical doctor who needs to know this information, then we would think about how does this person diagnose? And then we will determine the data required. This will be the first step. So we need to specify the problem in order to data required. And then we will discover that we have different types and different formats. We all know that now with the currently used software tools, we can deal with different types. It's not like the old times. It's not like the text. No, we're talking text, we're talking audio, we're talking video, we're talking images. many types of data needed to solve this problem. So that's usually the first step. And I think that's the most important one because it will lead us through the rest of the data analytics process and will help us find suitable and useful patterns. Second step or second stage will be about collecting the required data through a variety of sources. Again, as we all know, it's not only one source. We have various sources. We're not only talking about records, about files, about interviews done with people, but sometimes we're mainly faced with the social media. Nowadays, social media plays a crucial role in the data analytics process regarding the data collection phase, because it's a means to have many, or let's say to have a big amount of data in the easiest way. Although we're faced with a very important problem, which is the credibility of these data. So even if we go or if we rely on the social media, we have to check the source of data published. So that's the second stage. Third stage or third step is trying to organize and analyze these data. So we'll start by determining the required data, collecting these data through various sources, various available sources, of course, because that's a point that we face in COVID-19, as I will explain later in my presentation. And then trying to analyze these data, whether using AI techniques, mathematical or statistical, and this depends on the task, it depends on the tool used, it depends on the data provided. We have many parameters here. And finally, the cleaning before analysis. Cleaning is very important because if we're going to rely on bad data, as we used to say that garbage in, garbage out, then we will definitely get bad or wrong patterns. And these patterns will influence the decision making in a very negative way. To sum up this process, we can say that the data analytics focuses on conclusions. But if you see what I just wrote here by the end of the slide, that these conclusions are based on what the analyst already knows. What do I mean by this controversial sentence? Is that we already have data, so we can rely on these data. But the way we select some attributes, the data we collect from various credible sources, the way we organize it, the way we clean it, will help to come up with useful and reliable. Now, regarding the data analytics, how many types do we have? As you can see using this diagram or this illustration, that we have descriptive, diagnostic, predictive, and prescriptive types. As we all know, different enumeration or different specification of these types, but I will make use of the 4 types for the sake of my presentation. So if you go to descriptive analytics, what's descriptive analytics? It's simply trying to describe what has happened over a given period of time. For example, regarding COVID-19, has the number of people having this virus, the coronavirus, gone up or down? What about the curve? Is it better? Is it worse? What about the death? What about people who are fine right now, who managed to fight this virus? So we need to describe the current situation. That's what we mean by descriptive analytics. Second type is diagnostic analytics. Diagnostic analytics focuses much more on why, the reason why something happened. For example, why do we have more people affected? Why do we have more people infected by this virus in a certain country. What led to this? And that's equally, if not more important than the first type, because it's not enough to know the number, if it's more or less, but it's much more important to fight this number by knowing the reasons why it got more, why it is increasing, not decreasing. The third type, which is very important as well, is predictive analytics. What do we mean by predictive? It's trying to moving to what is likely going to happen in the near future. And as we all know, we need this badly with this pandemic, because we need to allocate resources in order to face it. We need to invest in getting some treatment for those who are infected with this virus. So we cannot wait till we have an increasing number of people infected with the virus in order to react. I guess in our example, regarding the predictive analytics, this has to be given to the decision maker on the nationwide. I mean, it's not only for healthcare professionals or for us as scientists or as researchers, but the results here would be more directed to decision makers on the upper level. Finally, the prescriptive analytics, which really completes the cycle here, because it is concerned with suggesting a course of action. So for example, if we take the COVID-19, then we will try, first of all, to describe the situation in each and every country, and then to diagnose the reasons why we reached this situation, and then to predict what will happen in the future, and then to find...
Excuse me, ma'am. Ma'am, slide, please not show. Slide not visible.
Is it a question? Can you hear me?
Slide not visible, ma'am.
Excuse me?
Slide not visible.
I can...
Slide is clearly visible.
The slide is not visible? Dr. Heba, can you hear me?
Dr. Naveen, could you reshare the slides again?
Yes.
Some of our
Slide is not visible, ma'am.
So you cannot see the slides again?
Ma'am, slide is visible.
Please reshare presentation again, please.
And okay. It's very weird. Okay.
Ma'am, slide is not visible, ma'am.
Actually, good evening, sir. Actually, slide is visible only on that time also. Somebody logged in as a presenting mode.
Excuse me, ma'am.
You are requested to pin your screen to Naveen Ravi presentation
Slide is not
1.
visible.
Yes, Dr. Naveen,
Slides
it's
are
okay.
clearly visible. Please do not interrupt our respected speakers. Please pin to Naveen Ravi presentation. Scroll down and choose to pin Naveen Ravi presentation. The second one with the same name. Please do the needful. Slides are clearly visible.
So now it's okay?
Participant. Yes,
ma'am.
okay, ma'am. You can continue.
Okay, great.
Visible, ma'am. Visible, ma'am.
So do I need to repeat the data analytics types, or is it okay?
Ma'am, slides are visible.
Slide is visible right now.
Yes, ma'am.
Okay, thank you so much. And you heard the explanation or the explanation of the 4 types, right? Do I need to repeat any of the explanation about the types of data analytics?
No, ma'am. No, ma'am. You can carry on.
Okay. So to sum up, using these 4 types, we can manage or we can successfully move data from insights to impacts. We used to say that we only have data and then information provided to decision makers, and then we took a wider step, saying that data will come up with insights, but regarding the data analytics, we're talking about impacts. How to make use of these results in order to fight this coronavirus. Okay. So what about the role of data management? Not data analytics. If you think about data management, you will find that we already have some usage for it regarding COVID-19, like for example, how to make use of demographic information in order to reach out to people who are at risk of getting this virus. Second, how to assist in the contact tracing, which is a very important topic nowadays. And finally, how to support the healthcare professionals to optimize, to reallocate the resources available in order to fight this virus. A very important point to think about is the deep analysis or the analytics of the data related to this pandemic to get the insights before embarking into data analytics with its 4 types to see how we will get impact out of insights. So we already have some analytical frameworks that have been designed in order to rapidly assess or evaluate the situation in different countries so as to mitigate the health and economic consequences of the virus. They need to just follow up the numbers if it's increasing or decreasing, because it has consequences all over different aspects, not only the lives of people, but also the economic status of the country. These analytics used in these frameworks are fact-based, and they are unbiased and can be accessed free of charge. But as we just mentioned, because that's one of the main challenges, we make use of this fact-based and unbiased. But are we sure that it is really fact-based and unbiased 100%? That's one of the main challenges that we face while collecting, organizing, and cleaning data related to COVID-19. We also have to use some metrics and analytical techniques in order to get some numbers, not only normal trends, because we will provide this to different decision takers and decision makers in different countries who are responsible for fighting or for dealing with the consequences of this pandemic. So now we explored what we mean by data analytics. What about this pandemic? The 4 stages that make up the process of the data analytics, and the 4 types, and the currently used data management techniques. But are we ready to implement data analytics in different countries in order to fight this pandemic? That's a very valid question. So let's explore the current status. Although we have very nice apps and frameworks and algorithms that we can make use of in order to get trends, we, on the other hand, are faced with fragmented health data. For example, in Egypt, although we have very good systems, sometimes we cannot really go for interoperability. What do we mean by this? We mean that we have different systems, different subsystems in different medical institutions, and we cannot really link between all of them, although we started with a digital transformation in our country to do so. We started to work on adding some smart things or metrics or techniques in order to be able to link between data coming up from different institutions, but we still have the problem of fragmented health data. So as long as we have this fragmented health data, it will not be easy to come up with indicators or trends to be used all over the country. On the other hand, we have very nice health apps that enable consumers, let's say mainly the patients, to participate, to get more responsibility regarding their own healthcare management. So we have kind of two extremes. We have data that is not linked, but we have good technologies and we have very useful apps. What can we do about it? You will find that so much of that data is already out there, but we're not making efficient and effective use of it. What we need is to find a usable way to manage health records. We'll go back to this data management, because we cannot claim to apply data analytics if we cannot even go for the traditional way of data management, and not data management if we have different silos. So we need to have kind of a way to link between the current subsystems in different institutions. As we all know, we should really think about different perspectives. Are we coming from the medical doctor's perspective or the patient's? And as you also know, we as software engineers working on coming up with useful systems, or we as data analysts working hand in hand with different stakeholders, we have to adopt both perspectives. Let's start to take each perspective with every mindset. So regarding the medical doctor's perspective, what they always mention is that most of the things they do is based on evidence. They have what they call evidence-based medicine. So when you just go there and talk about many signs and symptoms and so on, they say we need to stick to evidence. That's why that we'll find that data extracted from different places, such as doctors' offices, clinics, institutions, pharmacies, labs, may be used to detect useful patterns, but it needs to be used based on evidence. On the other hand, you will find that many companies and healthcare providers are kind of adding more layers of information in their apps or in their systems in order to benefit out of the evidence-based data that is already there. So that's the mindset of the medical doctor, or let's say of the healthcare professional, to make it more generic. What about the patient's perspective? You will find that the currently format of data is changing the role of patients. Why? Because it's offering them to play a more central role, take care of their status. Why? Because we can communicate many of these data to the patients via mobile apps. So making use of mobile technology has made a great influence in this domain. We will also find that many companies worked on advanced devices in order to be able to provide continuous monitoring of many key metrics. So we can really monitor the status of the patient, and the patient accordingly can take part of the decision in order to take care of itself or herself. You'll also find many companies like Apple, and nowadays Apple is working with Google as well, in order to become kind of repositories for all these information. Because we need to collect data, come up with information and insights in order to have an impact. So we need to provide and to keep this data safe. What's our final goal here? Our final goal is to create a central repository where researchers, of course, from different fields, from IT, data analytics, medical field, and be able to explore and examine the data coming from multiple various sources simultaneously. Why? Because we need to allow data to be readily available to many different experts in different domains, so as to apply the analytics and to make an impact, especially fighting the COVID-19. How important is our data? As we usually apply the saying, torture the data and it will confess to anything. So another question here, we first of all explore the question of are we ready? And the second question is, can healthcare professionals make use of data analytics to fight COVID-19? Let's explore the contribution of data analytics. We can make use of data analytics for early detection of this virus. As we know that early detection will help to cure most, if not all of the people or all of the patients who got this virus. It helps a lot. Secondly here, differential diagnosis. By differential diagnosis, we mean that we need to differentiate if it's a flu, or if it's COVID-19, or if it's a third disease. And maybe you heard that MIT and Harvard have combined their efforts in this area and are currently having a system making use of AI. And this system is currently diagnosing COVID-19 based on voice. It has a nice motto saying, do I sound sick to you? If you think about it, it's very simple. Usually when we call someone and then we hear the voice of this person, sometimes we ask the person, do you have flu? Are you okay? So they did the same. It's based on speech. They already trained their system and they came up with very nice results. So that's what we mean by differential diagnosis. Data analytics can also help with the prognosis. What we mean by prognosis is kind of predicting where are we going out of this disease, what if this cure will be really effective or not. So it's what's coming afterwards, kind of applying predictive analytics. A fourth usage of the data analytics in this domain will be to find possible cures faster, because we cannot really wait for too long. This process is time consuming, and unfortunately, every day we lose people. And finally, to help track the spreads, which again is a very important point, as we mentioned it before, tracking how and why it will spread in order to be able to overcome this. You will find many different, let's say, apps or systems or projects related to COVID-19 using data analytics. One of them is what Johns Hopkins University Center for Systems Science and Engineering has done. It has already created a real-time visualization of the outbreak. The map we see every day, the listings of the total number of cases, deaths, and Bengal people recovered. So we have this map classifying all of these important numbers, and it's reachable at any point of time. Numbers are also broken down by countries, which allows us to make kind of, let's say, a comparison, which allows us again to find the reason why. Why do some countries have more cases than others? Because as we just know, it's not only describing the situation, but knowing the reason why and predicting what will come in the future in order to come up with kind of proactive measures. That's what we need, not reactive measures. Okay, because we cannot wait till the number of cases and deaths increase. What are the sources? As we said that for data analytics, we have different sources. So here we have the WHO and the CDC, among other very credible organizations. In order to do this map, you'll find that Johns Hopkins University is making use of Esri's ArcGIS for the visualization. And I think this is very useful. And I think, again, that all of us, not only us as data analysts or data scientists, but all of us are making use of this map. Is it enough to track the cases of COVID-19? Actually, no. So only watching people to see who's sick will not be enough. We need a different form of surveillance. Why? Because as we know that this COVID-19 is evolving rapidly. So we need to track how COVID-19 mutates around the world. There is already a system making use of data analytics that work on it. And it's coming up with kind of prediction in order to know how this coronavirus will mutate and what to do with it, how to decrease the bad impacts that will cause, how to come up with vaccines, how to come up with cures. So again, scientists cannot wait till this virus mutates in order to start working on it and start working vaccines and treatments. We also have here the case monitoring. You will find that many data analytics systems that make use of artificial intelligence and machine learning, so they're not only based on statistical, but they'll go for deeper analysis with more sophisticated ways. Nowadays, we're talking about machine learning and deep learning. It will help organizations learn from past events. Why? Because artificial intelligence simply is a way to trying to make use of the human intelligence. So we're trying to imitate this human intelligence. And one of the good points is trying to learn from experience. That's why these types of analytics will rely on artificial intelligence, because it will mainly focus on how to learn from past events and how to create new knowledge out of it. These types of analytics are making use of the suspected new cases. Why? It will be monitored and then it will be confirmed whether it's a positive or a negative. We cannot start from scratch. We need to benefit from past experience. And that's the role of artificial intelligence and machine learning here. Accordingly, the government agencies will focus on monitoring the confirmed cases. They will check where they have traveled, and they will come up with more new trends. We need to come up with new patterns. We need to uncover new patterns, and we need also to know where did they go in order to predict what will happen next. So here it's as if it's kind of sitting in the middle. We need to know why they got it, and we need to know where they already spread it. We have also the syndromic surveillance. Many organizations are focusing on this task. They're trying to detect individual and population health indicators. Again, we're talking about confirmed cases. How would they know? As I said early in my presentation, that most of the time nowadays we're relying on social media. So using social media, you can have kind of indicators where we're going now. I mean, how many cases are confirmed? It's not only registered cases registered in a formal way, but we need also to check social media. Here we make use of smartwatches. Okay, now we're making use of more technology because data about a change in heart rates and sleep could provide early indications that a person is unwell. We had previously said that data analytics may help in early detection. So we will not wait till someone comes up after being diagnosed. No, we will try to track or to follow or to check, to detect these points, because after studying many confirmed cases, we got to know that changes in heart rates and changes in sleep is one of the symptoms. That's what we really mean by data analytics. When you go for huge amount of data that is collected from various sources, various credible sources, and we work on it, and we come with new indicators, these indicators can help us to fight this virus. How? Because we will apply it on other people who were not diagnosed as having this virus, and we will check if they really have it or not. That's the cycle of the data analytics. Again, speaking about predictive analytics, we will have here the disease spread prediction.
No voice,
Madam,
Dr.
kindly
Nabeel.
unmute your mic,
Can't
please.
hear you.
Somebody has muted. Please, participants, do not mute our honorable speaker. Please do not mute our honorable speaker. It's a request. Please do not mute our honorable speaker. Professor ma'am, please kindly unmute your mic.
Dr. Nabeel, we can't hear you. No voice.
So is it clear now?
Yes,
Yes,
it's okay.
ma'am. Yes, ma'am.
Okay. Someone muted my mic. So. Okay, can you see the slide right now?
Yes, yes, yes. Yes, thank you.
Great. Okay. So, okay. So you heard the syndromic surveillance, right?
Yes, Dr. Nabeel, it's okay.
Dr. Heba, should I proceed with the disease spread prediction?
Yes, yes.
Okay. So I was talking about the disease spread prediction, and I just said that predictive analytics will be applied here. It will go from collecting data from different public locations, such as hospitals and airports, with the view to determine the disease spread and risk. Why? Because we need to know if these people were kind of released from hospitals, or if these people were traveling or just came from other countries, and we should provide the indicators or the patterns or the trends discovered to hospitals in order to plan the resources accordingly, and to airports in order to get to know how the spread will affect the country afterwards. Again, we talk about the contact tracing. So there is a system that's focusing on how to devise a speedier way to handle contact tracing. Why? Because contact tracing usually is very time consuming. But on the other hand, it's an effective way to slow the spread of COVID-19. Okay? Because it thinks about how or who was or got in touch with the person, after this person has tested positive. In Oxford University, they have already succeeded to create a mobile phone-based solution to eliminate the need for people to call the contacts manually, which is a very valid point nowadays. Those parties will get text messages to confirm if they need to self-isolate themselves. And the researchers of this project or system has already clarified that this approach will be very effective if it gets support from national leaders. It cannot be only a research project that is implemented or applied or being used by some of these people, some of the patients who have this virus. But we need to make it worldwide, we need to make it nationwide. Especially that we have now market penetration of mobile phones and people are getting very familiar with receiving text. So it will be a very nice and effective way to reach out to those patients without causing more problems, without contagion, without increasing the number of people infected. A very important system as well is the COVID symptom tracker. Why? Because nowadays we have people who had no system at all. I know many of them in Cairo, they had no system at all. And some others had only mild symptoms that can be mistaken for flu. The problem with these people is that they infect others without knowing that they have the virus. That's why we have some system developers who thought about having an app that make use of data sharing to help the experts in the medical field to learn more about the virus. This app is called COVID Symptom Tracker. They're trying to share all of the data, so each one of the patients share the symptoms he had, symptoms he suffered from. So as we get more symptoms and more cases, we do not stick to the usual ones that we know. And when we interact with this app, then we will add to the symptoms uncovered here. So people interact with the app to do a short daily symptom check-in. They give age, postal code, and any pre-existing medical conditions. This information will help scientists to determine the groups that are more affected or more at risk. And the app, of course, is not going for any commercial purpose. It's just trying to get more symptoms, to get to know about more symptoms in order to help to cease the spread or at least to decrease the spread of this virus. Finally, here we have mobility analysis of population during the current time. Understanding how the population moves is very important to prevent the spread of the virus. But here we have a very big challenge, the data privacy. Because if we need to follow people, then we'll be kind of invading their privacy. And that's a point that's really causing a challenge for us. So we're not only talking legal aspects, we're talking privacy and ethical aspects. The COVID-19 mobility monitoring project implemented in Italy made use of data collected from anonymized users. These users agreed to provide their location data. These data were collected using smartphones with different operating systems, whether we're relying on iOS or Android, and using multiple sensors. The goal of this application or of this system or project was to go for quantitative analysis. Why? To study the impact of the quarantine, of the social distancing measures imposed. Is it really functioning or not? Is it effective or not? Are people applying it? What about its impact on the spread? These were some of the questions raised in this project. Okay. So I guess in this session, we talked about data analytics, difference between data analytics and the traditional or usual data analysis, the process, which includes 4 stages, the 4 different types for the sake of our presentation. We applied these 4 different types with examples. We explored the actual status. Are we ready to apply data analytics in a more effective way, or do we need to make some adjustments in all of our countries? How to make these adjustments, and different examples of current systems, research projects, and apps that rely on data analytics with its 4 types, and that's working towards fighting the COVID-19. I guess by now it's time to take 5 minutes break. And then after the break, I will be talking about the inhibiting factors of data analytics implementation, the different challenges that we're facing, some proposed solutions, and some change of the mindset in order to make kind of a cooperation between us as IT professionals and healthcare professionals pertaining to different organizations and institutions towards the progress of fighting COVID-19 worldwide. Okay? Thanks a lot for your attention, and see you in 5 minutes.
Participants, please be with us. It's only 5 minutes break, then the session will be resumed. At the end of the session, the feedback link will be provided in the chat box. Thank you.
So welcome back. So, can you continue? Are we all
Excuse me,
there?
can you hear me? Can you hear me?
I can hear you.
Can you hear me, ma'am?
Yes.
Hello, excuse me.
Hello?
Yes, Dr. Nidin, we hear you.
Okay, great. Dr. Heba, would you please help me? Do you see the presentation?
Yes, ma'am. We can see your presentation.
Okay, great. Thank you so much. Okay.
Thank you.
So as we said previously, we were talking about COVID-19 pandemic. We talked about data analytics. We tried to define the concept of data analytics along with the process, stages, types, and usage in order to fight this pandemic. Now, let's explore why we cannot really make better and more effective and efficient use of the data analytics in this domain. Now, thinking about the current status, let's discuss some inhibiting factors of this implementation. First of all, we will be relying on data. So if we talk about data, then we're talking about the amount of data. Although we have huge amounts, but it might be scattered, it might be fragmented, as we said, so we cannot really get hold of all of it. We always say that the number of registered cases is so and so. We can never say the number of cases and be really sure that that's the total we have. The availability of the data, because some of the data is not available. Why? We have different reasons. Sometimes people don't really like to talk about it. Sometimes maybe countries or organizations think that they cannot unveil or uncover all of their data due to privacy or security reasons. The lack of standards of these data, we're not really making kind of one standard that fits all in order to try to fight this pandemic worldwide. That's a problem. The quality of data provided, is it really good quality? I mean, even if we go for cleaning, would this be enough or not? Having some biases is a problem as well. And finally, do we apply data governance? Are we really implementing rules and regulations in order to make sure that the data analytics throughout all of their phases, the 4 phases, right? I mean, are we really working on right suitable, updated, complete, and not biased data? Yes or no? That's a question the data governance tackles. Another factor is the ecosystem of healthcare. We're not only talking about medical doctors, we're talking about different organizations. And we don't really have control over all of it. The third and very important point is the privacy and accountability and laws in each and every country. Privacy issue plays a very important role. Are we really, ready to say everything about ourselves, to provide all the required data or not? That's the point. Are we accountable for what we say? And what about the laws that are there? Should I proceed or there is a problem? Okay. The ethics or the ethical part plays a crucial role. How much do we know, and are we ready to keep the secrets, as the expression says? And finally, the shortage of skilled personnel. You can see nowadays a very high demand for data analysts, data scientists, and so on. Okay, that's a very important field, and we need these people to have very sophisticated skills, because they're the ones who will conduct these studies, and they're the ones who will provide us and other decision makers and takers with patterns in order to take suitable decisions. Okay. If we explore the currently faced challenges, we'll find the lack of data standards. We don't really have a common standard or model to follow. We don't have kind of, let's say, a different format or a template agreed upon whenever we tackle any case infected by COVID-19. So if you cannot find it in each and every country, how can we have a study that tackles all of the countries, especially that we're talking about a pandemic? It's not just a disease that's spread in one or more countries. So we need to tackle it in a different way. The biased findings. Are the findings really not biased, as we just said? They're fact-based and they're unbiased. Is there a way to secure that these findings will not be biased? Sometimes we share the sponsor of the study of the research projects or the, let's say, the app or the system, in order to be sure as much as we can that the findings are objective, not subjective and not biased. But is this enough to provide us with unbiased findings 100%? That's a question. The interpretation of the learned patterns. Because, for example, in Egypt, when we compare between two governorates, and then we say that this governorate has more cases, can we provide valid interpretation? The part of the prescriptive, the descriptive, the diagnostic. It's not only a number, but are we able to apply all of the other types in order to interpret the results and the facts provided by the end of the study? That's a challenge. And the biggest challenge, of course, is the personal information becoming public. Are we ready to give all of our personal information? Not always. Even if we think that that's for the benefit of everybody, sometimes we keep some of these information for ourselves. Okay, speaking of the proposed solution. There are 3 proposed solutions, and maybe you can add afterwards in the feedback or when you try to send me your questions. First of all, trying to transfer learning, the knowledge transfer. Now we said that we will make data in order to get insights, and then to work on these insights in order to make an impact. So these insights or the knowledge discovered by the end of the process, we should find a way to transfer it to other stakeholders, to other people who need it. Okay, that's the knowledge transfer and the learning transfer. Of course, designing a common data model is crucial nowadays. It will help us find a cure. It will help us measure the effectiveness of different treatment. It will help us uncover the symptoms that are not really known till now, and so on. And finally, applying both ways, quantitative and qualitative analysis. We cannot rely on one of them only. It will not be enough. So as to conclude our talk, we have three main points. First of all, we should focus on making proper utilization and allocation of the resources, whether we're talking about healthcare professionals, whether we're talking about hospitals, about equipment, about medicines, and also to make good use of the knowledge discovered. That's for the aim to deliver clinical and financial benefits to meet this challenge. A second very valid point is to work towards having a data-driven organization. So if we talk about the healthcare ecosystem, we should think about each and every organization or institution that's there, that it should be run using data. We should benefit of this wealth of data that's available nowadays. This will help us or enable us to have effective insights, and then each institution or organization will have its plan, and it will account for the plan of the nation as a whole in order to fight this pandemic. Finally, the data-driven technologies, they will always be the ones that we're working on for the coming generations. As you see that we're applying more and more techniques, we're coming up with research that deals with more algorithms, more metrics that help to apply the data analytics in order to benefit everyone. How to make progress against COVID-19 using analytics? We need to be sure that knowing as much as we can about the virus will save lives. Maybe if we think about that point, we will provide everybody, not everybody, I mean, we'll provide people who are accountable, who are working using these techniques. We'll provide them with all of the required data, as we said, that was the trigger of any problem to determine the data requirements. And we will enable the data analysts to apply their skills using these data in order to come up with insights and make an impact. Of course, taking into consideration that the data analysts should improve their skills. They should know more about more tools, more algorithms, more techniques. They go for more comparative studies, comparing between different tools and techniques in order to get the maximum out of the currently available data. So as we always say, that while analytics isn't sitting in local doctors' offices taking samples to be tested, these technologies, the analytics linked with other technologies and sensors, the analytics making use of AI and machine learning and deep learning, are being employed to help the overall effort and to make doctors and healthcare organizations more efficient and better equipped in order to fight the spread of this virus. Especially that, as we all know, it's muting, so we need to really track it. We need kind of a mindset change, and we need to accomplish kind of a culture of trust between data analytics who are providing, or data analysts who are providing insights in order to satisfy the needs of different healthcare professionals. That's kind of the marriage, if we dare say, that we build the culture of trust between us as data analysts and as IT professionals, and with our end user, who are mainly different healthcare professionals when we talk about COVID-19. final word. Pioneering spirit should continue, not to conquer the planet or space, but rather to improve the quality of life. Thank you so much for attending the session. And thank you so much for being there all of this time. Hope it was an interesting session for all of you.
Participants, if you have any questions, you can raise your questions by typing it in the chat box.
A way for communication, if you may allow, since we are many participants here, or maybe about 250 participants, then can I suggest that you send me your questions, whether on Facebook, on LinkedIn, or my email. I can share all of this information so that I can answer each and every one of you separately, because I don't think that it will be effective to handle all of your questions right now. So would you like me to write it on chat?
It will be fine, ma'am, if you answer the questions in your Facebook and other media.
Ma'am, I have one question. Hello.
Yes.
Hello.
Yes.
Yes, ma'am. I'm Siddhartha Chatterjee from Kolkata. Okay. Ma'am, yes. Today, actually, unfortunately, ma'am, can you hear me?
Yes, yes, I can hear you perfectly.
Yes,
Go ahead.
yes, ma'am. Actually, today I am unable to join. Okay, just 1 minute. I have joined. Okay, so ma'am, I have one question, ma'am. Your topic is data analytics to fight COVID-19. Okay, ma'am. So, is there any mathematical model or how COVID-19 virus will be spread? Basically, we only know about it is spread based on a exponential rate, e to the power t. But I want to know some mutation parameter, basically. So how COVID-19 virus or SARS virus will be spread.
Okay, so out of my readings, when I was preparing for this talk, then it's not, they started by having it mathematical, but right now they're not making use of mathematical. They're more including the AI and machine learning. So if you send me your email, my email, I'll send you 2 papers that tackle this point.
Hello, I have a question. Hello, can you hear me? I have a question.
Please unmute your mic.
Hello, ma'am, can you hear me? I have a question, please.
Yes, go ahead.
Okay. I think you can hear me. Thank you for your wonderful introduction. My question is that giving prediction of affected people or number of death based on the data analysis of COVID-19, how much it is working effectively still now?
1 second, I will reread the question because I could not hardly.
Okay, I repeat.
No.
I repeat. Giving prediction of affected people or number of death based on the data analysis of COVID-19, how much it is working effectively still now?
Okay, I cannot provide you with one number that fits all, because if you go, for example, to ResearchGate, you will find that they have kind of a platform that's dealing with all the researches dealing with COVID-19, with the kind of the prediction, and each and every, let's say, research gives by the end of it a number. They say that it's effective, but as you know that each and every day we come up with new parameters or let's say new variables that we're not taking into account. And as I was just discussing that sometimes we say that it is not really fact-based because it is relying on the available data, which is not enough till now. That's what we discovered using many research. And sometimes it's also biased. So again, if you go to ResearchGate, you will find plenty of research papers tackling this point. Each research paper provides kind of a percentage by the end of it. But again, as you know, as a researcher, that this percentage is, I mean, it's only linked to this specific study, to the study that was making use of some of the cases provided. So you cannot take it as a measure. It's only a metric or it's only a finding of this specific research. But now with the deep learning, since we're getting more variables, more attributes into consideration, then we are getting better and more effective results. I hope the answer satisfies your question.
Thank you.
Okay, ma'am. Ma'am, hello, ma'am.
Hi.
Ma'am, I have another question or last question in machine learning concern. Okay, if I want to detect COVID-19 virus, so which process is best, basically, supervised learning and unsupervised learning? Because we all know about the COVID-19 virus will be highly muted or highly spreaded, basically. So here, supervised learning is not so good with the comparison of unsupervised learning. So if we use unsupervised learning for the detection of COVID-19 zone, basically, or virus zone, basically. So one of the famous algorithm is K-means clustering algorithm. So apart from K-means clustering algorithm, is there any another algorithm, or how we can proceed, basically? If I want to write a algorithm for spreading technology or mutation technology.
Again, I'll send you more details regarding this, but if you take my opinion based on the studies that I went through, because I was working on a paper lately, that's definitely for unsupervised learning, because
yes,
as you know, that we need to uncover many patterns that are there, so we cannot apply, it's not that we cannot, it's better, much better to apply the unsupervised, so as to discover more. If you go for supervised, you will see what's already there. Again, please contact me on email and I'll provide more details of different techniques, because some of the research papers have done a comparative study between different, among different techniques, and came up with different good results that you can make use of it instead of starting from scratch. Hi.
Hello. Ma'am, I have a question regarding ensemble method in artificial intelligence.
Okay.
Can we find data mining approaches?
Would you please repeat? I can't even read. Okay, of course, regarding method in mining approaches. Okay, so you mean you want to combine data mining, or you mean you want to go for data mining using, for example, artificial neural networks?
Data mining.
Okay, so you want to apply data mining. Okay, as you know, data mining comes up at the end by providing us kind of actionable information. Here, we move a little bit further. It's not only applying data mining, so we go through the process of collecting the data and then storing it kind of in a data mart or data warehouse, which is very, I mean, very useful. Okay, and then coming up with new patterns and then having this report having actionable information. No, here we are digging much more. We're digging deeper than the data mining. We're going further in order to provide insights and make an impact. If you want to go back and use of data mining, it's very useful. Apply data mining techniques. Of course, I will advise you to make use of neural networks, since I see it as an AI problem. And then you will come up with actionable information, which is less than coming up with insights. I think you know the difference between data, information, insight, and impacts.
mm, Hello. Hello.
Yes, yes, I can hear you.
Okay, so Professor Lavi, we are not taking any more questions. If participants have any queries, they will send their questions to us. We will forward to you, or you have also shared your details with them. They can also mail the queries to you also. Otherwise, session week cannot be end. So, and the feedback link will be shared by Mr. S. Ghosh, the coordinator of the program. So I would like to just thank, on behalf of IMPS College of Engineering and Technology, I would like to thank you for accepting our invitation and delivering such an informative, interactive, excellent, well explained, fruitful, interesting session on one of the most acclaimed topic related to data analytics as per present pandemic situation across the globe. We wholeheartedly thank you for spending your precious time with us. It was really nice having you as our honorable.
Thank you so much for the invitation, and it's a pleasure to be with you. And I really hope we meet again, and we can communicate through different social media measures, whether Facebook, LinkedIn, or even contact me by email. And thanks again for your kind invitation. It was a pleasure dealing with you as eminent professors and having such nice.
Thank you, ma'am. Thank you, ma'am, for your informative session.
Thank you so much, and we hope to build a long-term association with you, Professor.
Me too. Thank you.
And dear participants, good night to all of you, and see you soon on 3rd July on another interesting topic, 3D printed antennas, its design methodology and challenges. Feedback link we are sharing. Please have a second. Patience. Keep patience. We are sharing it. Thank you, Professor. Good
Thank you,
night.
sir, ma'am, to attend us.
Thank you so much. Good night.
Thank you, ma'am. Thank you.
Participants, you are requested to be connected, remain connected due to the network problem.
Hello, good evening. It's better to share it on in Telegram group also, no?
Just keep patience. We will share it. Hardly it will take a maximum 1 minute of your time, because certificates should be allowed only to the active participants, na?
It's okay, thank you.
Sir, what's happening, sir? Feedback.
Participants, I have shared the feedback link. Sorry for the delay due to the network problem. Feedback link has been provided in the chat box. Please fill the same. Please fill it up.
Hello, Ghosh sir. Hello.
Yes, yes, madam.
So that webinar on 3rd July, we will be getting
Sorry, madam. Can you repeat? Can you repeat your
So on
repeat your
3rd July,
query?
sir, on 3rd July, we also had one
Right.
mail ID about that webinar.
Can you please repeat your query, please? I am not able to listen to you actually.
So on 3rd July, there is also one webinar, as you said in this forum.
Yes.
So we will be getting that link also in our mail ID or any kind of information we are going to get in our message, or how you'll get that. That I want to know.
Okay. I have already shared the registration links for that. I will share the same over here also.
So please, once again, you do it. Please, it will be needful for me. Thank you, sir.
Okay, I will share the same right now.
Okay, thank you, sir. Thank you.
Thank you. Welcome.
Hello, sir. Hello. Hello, sir.
Yes, Mr.
Can you
Vinay.
hear me? Yes, sir.
Yes,
What is
yes,
the time
I
of
can
the
hear
3rd
you.
July's webinar?
All the details are over there. Please go through. We'll have all the details over
Okay,
there.
sir.
Thank you.
Okay, sir. And what is the topic? Data analytics. We will continue. Hello, sir.
No, on 3rd July, we are having it on a different topic. It will be on 3D printed antennas, its design methodology and challenges.
Okay, sir. Thank you, sir.
Welcome.
Hello, sir.
Thank
Hello,
you
sir.
so
Is it
very much.
audible?
It was a very wonderful session. Thank you so
Yes.
very much.
Hello,
Thank you,
sir.
madam. Thank you. Yes, yes, yes.
Can we
Mr.
get that?
Nasima.
Can we get PPT, sir? Can we
Sorry,
get that
PPT.
PowerPoint presentation sheet, sir? Hello, sir.
Yeah,
Could we
yeah.
get that PPT?
PPT, if you need it. Hello, can you hear me?
Yeah, I need it, sir. Yeah, we need it, sir. Okay.
Okay, if you.
Hello, I am sharing the information of the webinar to be.
And I will.
Yes, sir. You can continue. I'll announce that later.
Okay. So the the PPTs will be shared now. It will be better for us, sir.
Yes.
Would it be provided in the Telegram app only, or it will be shared, sir?
Yeah, then we will provide it on that group too. If you are having in the Telegram or WhatsApp group on that this session date, we will share there.
Okay. I am in the Telegram group, sir. It would be better, like we are exiting from here if in the chat box now. So it would be better, sir. Thank you, sir, for excellent session.
If you regret that PPT, please remain in that group till we post the
Okay. Okay. Thank you, sir. Thank you. Thank you. Now, Indians Narasimhani will train karan. Nothing
I have shared the registration link for the upcoming webinar on 3rd July. I have already shared the registration link and the WhatsApp and Telegram groups link. You can see in the chat box. If you are interested, then you can join the same on 3rd July.
Hello, sir. Hello. Hello.
The webinar will be on 3D printed antennas, design methodology and challenges.
Sir, can you hear?
On 3rd July 2020, time is 6 p.m. Indian Standard Time onwards.
Sir, can you hear me?
Speaker, yes.
Sir, I can't able to join WhatsApp group for this session because I want to PPT for this session.
We are not able to share PPT here only. Please either you join the WhatsApp group or the Telegram group. We can share the PPT over there only.
Sir, I can't able to join the WhatsApp group because of full participants.
So it's alternatively you can join the Telegram group. Okay, there is no restriction of participants. You can join the Telegram group. We
okay, sir. Thank you. Okay.
Thank you.
ఏమైంది మళ్ళీ ఏం చేసినారు పోనీ నేను దుడిపేస్తా పోనీ మళ్ళీ ఏం చేసినా చెప్పు నిజం చెప్పు నేను దానికి మార్గాన్ని చూపెడతారా అయితే పోతా లేదా ఇప్పుడు ఇదంతా ఎక్కడికి వెళ్ళి వచ్చింది ఇది
Thank you for this wonderful session, sir.
Welcome.
Thank you, Guru sir. I have already registered. Thank you once again.
Welcome, ma'am. Welcome.
Hello.
Hello. Yes.
Hello.
Hello, sir. Can you hear me?
Yes.
Thank you, sir. Excuse me.
Hello, I want to say something. Okay, the recordings of this session can be provided, or if it is uploaded in the Google Drive, the Google Drive link will be shared or not?
Sorry, I didn't.
Hello.
Yes. Please go ahead, sir.
Shankar sir, thank you, sir. The webinar, sir.
Sir, can you repeat, sir?
Hello,
Thank you so
sir.
much, sir, for valuable webinar.
Shankar.
Mr. Sharma, you are going to say something. Please tell me what you want to say actually. Mr. Sharma, you want to say something?
I want to say that is the video will be provided of this session?
No.
Okay.